Hello, and welcome to the Center for Advancing Correctional Excellence, the second in our Justice Challenges and Opportunities in a Pandemic series, or JCOP. First things first, we at ACE wish to thank all the people on the front lines who can't engage in social distancing and who may be risking their own health in the service of others, including healthcare workers, first responders, corrections officers, and the people delivering our Instacart orders. But let's talk about social distancing and the very real impact that isolation can have on vulnerable people. There are, frankly, a lot of unknowns when it comes to how this pandemic will impact individuals with substance use disorder, but we can examine the risk factors it brings with it. The COVID-19 pandemic has unfortunately created a perfect storm to raise the risk of return to use for people in recovery from substance use disorders. First, it impacts people's ability to access care. This can happen in a number of different ways. One, people experiencing job loss may experience loss of health insurance without legal protections in place, thus making it cost prohibitive to access care. Second, some substance use disorder programs have had to shutter their doors or limit intake in order to protect the safety of current patients and staff. In addition, many people in recovery rely on support groups like AA to help sustain their success, and their options will be limited where people are not permitted to gather in groups larger than 10. Finally, a number of people with substance use disorder, especially those with histories of criminal justice involvement, may be living with other health conditions, such as HIV, that increase their risk for coronavirus and their need to physically isolate. The best weapon in our arsenal to help people whose access to healthcare has been limited due to the pandemic is telehealth. Telehealth, of course, refers to technology to enhance, supplement, or substitute for in person care. In fact, many healthcare practices are using telehealth to triage potential coronavirus cases. Last week brought some good news regarding telehealth for addiction disorders. Telehealth may now be used for first time prescriptions for buprenorphine, often known by the brand name Suboxone, which is a medication for addiction treatment. It helps to suppress or lessen cravings for heroin or other opioids. One of the limitations of telehealth is that without in person, face to face contact, people are receiving a different type of care than they are used to. Here are some strategies that can be used to help people feel more comfortable with the use of telehealth for substance use treatment. Set expectations. Providers should let the clients know that the technology may be new to them as well, and that the client and provider should expect some bumps in the road, and that's okay. Providers may need feedback in order to improve their ability to provide telehealth. They should let clients know that it's okay to give them feedback if the client is not feeling satisfied with their experience. And they should encourage the client to ask questions of the provider, ensure that the clients understand what the provider is recommending, and that the client should not be afraid to ask the provider something in plainer language. A major challenging in delivering telehealth is unequal access to technology. Many people rely on libraries or other public goods to connect themselves to technology, and many of those resources are not currently available. Consider how you can partner with your local public health providers, nonprofits, or government agencies. They will be your best resource to help vulnerable people. How many times since the start of social isolation measures have you heard someone complain about being bored or even done it yourself? Boredom and excessive free time can be risk factors for return to substance use, especially for people in early recovery. Social isolation can lead to return to use because feeling connected and supported is a protective factor against substance use and return to use. And this is hard to attain when someone is in a situation where they feel isolated or are in the company of people who are not supportive of their recovery. In these times, what can justice and health professionals do to help people feel more connected? Talk to clients about who provides positive support to them. Lack of physical contact doesn't have to mean lack of personal contact. And another resource that we want to continue to highlight is Addiction Policy Forum at addictionpolicy.org. And they have available a resource for individuals with substance use disorder that an app they can download free of charge that supports people in recovery during the COVID-19 outbreak. Another major issue we want to be aware of and address is that many, not all, individuals with substance use disorder are at risk for serious complications should they contract coronavirus. Dr. Nora Volkow, director of the National Institute on Drug Abuse, spelled out some of these issues in a blog post last week. COVID 19 attacks the lungs and could have increased danger for people who consume drugs via smoking or vaping. In addition, Dr. Volkow notes the risk for individuals with opioid use disorder due to opioids acting in the brainstem to slow breathing. and people who use methamphetamine, which constricts blood vessels and can cause pulmonary damage and pulmonary hypertension. Finally, we need to keep in mind the recovery professionals who serve individuals with substance use disorder. Not only are they prioritizing their clients over their own risk for spread, many of these professionals are in recovery themselves and also need support. Check in with people who are providing these needed services. Ask how they're doing. Ask if they are getting enough sleep and drinking enough water. Provide space for them to talk about what they're dealing with, and ask yourself these questions too. Social distancing is in all of our best interests right now, but we need to be mindful of its pitfalls, especially those that will affect some of our most vulnerable people. Thank you for listening. If you have specific questions for us or topics you want us to cover, you can tweet us at correctionsgmu or email rnrtool@gmu.edu. We care about our justice partners and the work you are doing. We are here to help. We will get through this together. Stay safe, wash your hands, and check in with your loved ones.